Dilated eye exam. So at the clinic here in Cunupia, we perform what is called a dilated eye exam. This is not a test for eyeglasses. That's a different type of test. In a dilated eye exam, eye drops are placed into the eye and that dilates the pupil, which is the hole that you see there. And when that hole is dilated, the specialist can now use their lamp and look at the front of the eye as well as the back of the eye, or the retina. So that is the purpose of dilation of the pupil. So what exactly is the purpose of a dilated eye exam? Well, the dilated eye exam can be used to diagnose a number of eye conditions. So let's start from the front to the back. So one of the conditions that can be caused by a dilated eye exam, of course, is a growth in the eye. Now you might say, well, if you have a growth in the eye, it would be obvious and you will not need a dilated eye exam. Well, the fact of the matter is it does not always start like this. It starts smaller. This is what is called a pterygium, or what is also called a growth in the eye. And when you have a lot of exposure to UV light, a lot of dust, you tend to develop a pterygium. Now the pterygium, again, I say it starts small and then it can grow larger like this. A minor surgery is performed by the specialist to remove the pterygium. So this is one of the conditions that can be caught early by a dilated eye exam. So you would sit in front of the lamp, the specialist will look at your eyes and begin to catch any defects on the anterior part of the eye. Right, so that pterygium that you saw there, that is on the cornea, so that growth would be on this part of the eye at the front of the eye. Another condition that can be caught by a dilated eye exam are cataracts. Of course, the cataract, that has to do when the lens of the eye become more opaque. The lens of the eye are made up of particular proteins, and when these proteins are destroyed or denatured, then the proteins are no longer transparent and they become opaque, and that is what a cataract is. Of course, one of the main causes of cataracts would be uncontrolled diabetes. So where exactly cataracts form on the eye model, and I'm going to show you that. So I've removed the top part of the eye here, cornea. I'm going to remove that, iris, and the lens. The lens right now. I'm going to remove this part here. That's the lens here. This is where the cataract forms. When the proteins of the lens become denatured, they're no longer transparent and they become opacified. And of course, they don't start with a total whiteout. It's gradual. Okay? So when you do a dilated eye exam, the specialist can look at the eye properly, look at the lens properly, and catch any early formation of cataract. So once again, the cataract has to do with the lens of the eye. So when you're doing a dilated eye exam, at the back of the eye is the retina, and this is a healthy retina here. Okay? That's the optic nerve exiting the eye here. Those red lines are blood vessels. Is the macula. This is the most dense part of the eye. That's where your clearest vision is on the eye. Now this here is a healthy retina. Okay? And I want to show you on the model. Specialist can now look through the eye and see the retina. Okay? So if any problems are starting to form on the retina, let's say problems with the diabetes or glaucoma, the dilated eye exam can be one of the tests that can give you an early diagnosis of a particular condition. But let's compare a healthy retina to an unhealthy retina. Okay, so first we'll just look at a drawing. So here's the normal retina, or the healthy retina. Again, that's the macula there, the blood vessels, optic nerve exiting at that point. Now in diabetic retinopathy or diabetic eye disease, you can see when you compare, there's certain problems. You have hemorrhages, you have aneurysms, which are weakened spots of the blood vessels, and the blood vessels tend to bulge in those areas. You have a leakage of certain materials, like lipids, albumin, which will form what are called the hard exudates. And then, of course, if you have something called cotton wool spots, what happens there is that there's reduced blood flow in the small vessels of the retina, leading to cotton wool spots. So this here is just a drawing, but let's compare two actual shots. Okay, so again, here's the healthy retina, and here's a diabetic retina. You see there's a vast difference. So something like this, when this now begins to form, whether you're in the early stages or late stages, a dilated eye exam can help to catch something like diabetic retinopathy. So that's a short summary as to what a dilated eye exam is all about. These are a very important test, especially for diabetics, those who are having a decrease in vision, headaches with watery eyes. So again, the diabetic eye exam is not for glasses. That's a different type of test. But if you're having problems with your vision, if you're diabetic, if you're having concerns where loss of vision is concerned, you can check us here in Chincuna Road in Cunupia, and you can book a dilated eye exam with the specialist.